morning, it's Lisa with Lisa Heal Yourself, and today we are going to talk about lower back pain, leg pain, foot pain. So pain that starts at your lower back and travels all the way down your legs and into your feet. A lot of people have problems with this type of pain. But before we go through stretches, we're going to do particular stretches for these kinds of pain, and we're going to look at what we can do. But before we do that, we're going to back up and talk about overall pain for a minute. So whether it's your mid back, whether it's your upper back, whether it's your neck, your face, your arms, your hands, your legs, your feet, it's important to remember that if you've had pain that is lasting more than 6 to 8 weeks, and I'm going to even go even further than that, and let's say 12 weeks, let's say all the way up to 12 weeks, this is not an injury. So it's not an injury that you sustained because bones, ligaments, muscles, nerves, things repair themselves. Now, especially nerves go longer, but if it's an injury, a physical type injury or anything wrong physically, your body will usually take care of it within 6 to 8 weeks. So if that's not the case, and after 12 weeks, you're suffering with pain, your body has learned the pain response. So if you haven't checked out on any of my videos on pain, on the psychological and the mind-body approach to pain, please watch those, because although it can seem very specific and very located to one area of the body, pain is pain. And if it's not healing and if it's chronic over 12 weeks, then we know that there's nothing physical wrong with you and that our mind is in a looping pattern of pain. And so the most important thing that you can do is to stop the pattern, the pain pattern. So again, if you haven't watched some of those videos, please watch some of those videos now. They're very, very important. They're probably the most critical part of stopping pain. All right, let's get specifically onto leg pain, lower back pain, and foot pain. One of the first things that you want to do for pain, any type of pain, is check your diet. If you're having refined sugars, if you're having the wrong oils in your diet, if you're having even a lot of a high carb diet, this is going to be a significant trigger for pain. So if you're experiencing pain, no matter where it is in the body, one of the first things I suggest is going on a low carb keto diet, if not carnivore, for a period of 30 to 90 days to see what happens. If you successfully do this over a period of 30 to 90 days, you should see inflammation and pain decrease. Now, the second thing that you want to make sure that you are having, especially if you're having leg cramps, foot cramps, anything to do with the legs, is you want to check your water and your mineral status. So please make sure that you are drinking enough water through the day. You want to make sure that you are getting magnesium, potassium, sodium, and calcium. These are critical for cramps, muscle pain, anything to do with the legs. You can add things like magnesium to your water. There's a brand called Calm. You can stir it in. You can get regular magnesium and you can take magnesium supplements. You want to be sure that you can add a pinch or a quarter teaspoon of Celtic sea salt to your water, stir it, some lemon, some magnesium. You can also get electrolytes. Now, please don't get Gatorade or anything with high fructose corn syrup, anything with food coloring, anything like that. That is not what we're talking about, but you can get healthy electrolyte minerals to add to your water. You can get them in liquid drops or you can get them in tablet forms and drop them in. If you are getting enough minerals throughout the day, this should alleviate a lot of cramping. One other thing I would like to note, if you are getting a lot of cramps, leg cramps, muscle cramps in the lower half of your body, you want to check your vitamin E. You can increase your vitamin E foods, almonds, raw greens, and spinach. We want to be making sure that we are getting enough vitamin E. Sunflower seeds also has a significant amount of vitamin E. So you want to be doing those things for leg and lower back, leg specific, whether it's upper thigh or calves, feet. The next thing I would do if I had lower back, leg cramp, feet cramps, sore muscles, anywhere down the lower part of my legs, is I would take several baths a day with Epsom salts. Now, I know this seems like a lot of baths, and people say, I don't have time for that. I would start the morning with a bath, a 20-minute minimum soak. I would end the day with a 20-minute minimum soak. And at one point during the day, I would try a 20-minute minimum soak. This seems like a lot of baths, but trust me, if you have lower back, leg, foot cramp, and you can spend a significant amount of time soaking with a significant amount, a large cup or two of Epsom salts. You can get them in bulk, even at the bulk barn, something like that. Go through them. This is going to help. This is going to help even more than any kind of stretching or exercising that you can do. The next thing to note, especially if you feel it's more bone pain, it's more in your bones, I would check your vitamin D status. So you want to be taking a vitamin D3/K2, and you want to be making sure that you're getting a high enough dose, 2,000 to 3,000 milligrams. You want to be taking this on a daily basis because if your mineral status is okay, if your electrolytes are up, if you are taking the baths, you're drinking the water, you're still having a lot of problems in your legs, or even you feel it's deeper. It's not really in the muscles, but it's deeper in the bones. You want to be checking for D3/K2. This is going to help with bone pain, anything that leads to osteoporosis. And getting enough natural sunlight is also going to help with this. So please make sure that you are out in the sun, getting enough sun. Don't shield your body from the sun. You need this in order to have healthy, strong bones. Now, if it's more in the feet and it's more a tingling, buzzing, burning type pain, neuropathic pain in the feet, we can be sure that your sugars are too high. This is a form of diabetes. This is a form of neuropathy. A lot of times this is because our sugar levels are too high. And again, a low carb keto diet or a carnivore diet is going to keep this in check, and it's going to start to reverse the numbness, tingling, burning sensations in the feet. The other thing you can try for muscle pain, particularly down the legs, lower back, is massage. Now, the more I find psychologically we attend to pain, we manipulate it, we put our hands on it, we're drawing energy to the pain place, and often it will increase the pain. It will get into that pain cycle. And again, go back to those psychological videos on the mind-body syndrome of pain. So I often find massage can lead us to this cycle of continued pain inadvertently. But if you are often going to be working and manipulating with massage, you can try a trick where you try the opposite, the mirror image leg. So if you're experiencing pain on one leg, you can massage the opposite leg. If you're on one foot or one part of the ankle, you can work on the opposite, the mirror opposite foot or leg. Similarly, all the way back up. So if it's on one side of your back, you can work on the opposite mirror image side. This is just a little trick that helps the brain release the pain without getting into a circular cycle of pain. So like I said, going low carb or no carb is really going to help if you really want to bump it up and see if you have inflammation in your body due to any kind of dietary or anything going on in your body. You can try fasting. If you fast, you should notice your pain going away, and this is a really good indication that your diet is not on point. So again, you can try fasting. The other vitamins and minerals that you may want to look at is your B vitamins, particularly if you're having a nerve pain or any of the muscles and nerves are related. Your B vitamins are really important. Vitamin B1, you can go ahead and supplement with a vitamin B1 supplement. You can also try stinging nettle, nettle tea throughout the day. This is going to be really beneficial for pain and muscle pain. So remember, especially if you're feeling burning or any burning sensations down your legs, vitamin B1, you want to get on that right away. So overall pain, you want to make sure that your mineral status is up, your vitamin D status is up. The burning is a sign of vitamin B1 and the B vitamin family. If you just have a hard time with the recovery of exercise or stretching or any kind of those aches, you may want to look at omega-3 fatty acids. This is really high. You can increase your omega-3 fatty acid foods, or you can just supplement with omega-3 fatty acids. This is a really critical. So usually if you're weak, your muscles just feel weak, you're checking your vitamin E status, increasing your vitamin E. If you're getting a lot of the cramping, it's usually magnesium, potassium, sodium, it's the minerals. So you really want to increase more electrolytes for all the cramping. If you're more having twitching in the legs, I would look at your calcium. It usually means we need to increase the calcium for getting a lot of the twitching. Again, another mineral, really important, really important. But if it's more like arthritis pain, joint pain, whether it's rheumatoid arthritis or osteoarthritis, we can look at the mineral boron. So go ahead and look up boron. You can add boron to your water. If it's arthritis, if it's joint pain, look at the mineral boron. And you can add it into that water with your electrolytes, with your magnesium, with everything, the powders that you have. And this should help relieve that. If it's heel pain, like plantar fasciitis, heels, we do need to work those a bit. Now you can use tennis balls, you can stand on those, or you can do a lot of massage. But remember, opposite foot, when you're stretching, stretch opposite muscles. So again, if you are using the opposite muscle technique, if you've gotten your minerals up, your B1, your vitamin E, your omega-3s, your calcium, you've tried boron, you're having anti-inflammatory diet or foods with a low-carb keto or carnivore diet, and you've tried fasting. Oh, and you're including vitamin D3. Your pain should go away or be very minimal. Soaking in the baths, you can put magnesium spray on the back of your legs. You can use anti-inflammatory rubs like arnica, coconut oil mixed with peppermint essential oil. These are really great for the muscles in your legs. And be sure when you're adding your minerals, you must add sea salt. Salt is so important, particularly for any kind of cramping or restless leg syndrome, anything like that. You want to up your sea salt intake. Now, if it's coming from your lumbar spine or your sciatic nerve, and we know that the sciatic nerve travels from the lower back, and it's a long nerve that goes all the way down. So sciatica often leads to leg pain, foot pain. So this is where you're going to be doing some exercises for your lower back to help your lower back, to stretch it out. Again, your bum, your gluteus maximus, you can be manipulating that because we want to help that nerve. Because pinched nerves are one of the things that are an injury. Again, if it's not healing though, over 12 weeks, then you're into a psychological pain pattern. So again, you're gonna wanna look at work like TMS work, which is not that it's all coming from your mind, but that the pain has gotten into a pain cycle in the mind. Okay, one more thing before we move on to the stretches. If you're doing your water with all your minerals in it, you can also do a juice. So this is the recipe that I would use to curb inflammation and pain in the body. So you want to use some celery, which really has some sodium in it. That's really going to be where you're going to get a lot of your really good plant salts. So juice celery. Go ahead and throw in a cup of really dark greens like spinach. This is going to increase some of those vitamins that we were talking about, or even something like parsley. You can throw in pineapple, and particularly the stem. You can juice that. This is really going to be great with bromelain. This is very, very anti-inflammatory. So throwing the pineapple in there is not just great for the flavor, but it's really going to get at the root of the inflammation. Nettle tea that you can put in there, or nettles, stinging nettles, as well as ginger and or turmeric, which is also very anti-inflammatory. And then lemon, which again is going to increase your minerals, as well as a little pinch of sea salt. So go ahead and try a recipe like this daily, every day. Hydrate with it. It's not only going to taste great, but it's really going to go a long way to reducing this leg pain. All right, so if you're doing all that and you want specific exercises for your back, your legs, your feet, I'm going to show you some of those now, so let's get to it.
Okay, so get comfortable. You can do it on your couch, you can do it on your bed. I like to go on a floor. You can even have a pillow if you have a strained neck. The first thing you're gonna do is do just like a little pelvic tilt. Okay, this is going to help with the lower back. What we do is we just kind of pull down, and you can even push up a bit. So it doesn't have to be perfect. We're just stretching out that kind of lower back with our pelvis. And remember, the goal of stretching is not to hurt yourself, not to, press into the pressure. A lot of people think like the more it hurts, the more I'm relaxing and releasing. So you can just do little ones like this, or you can come all the way up, part way up, or you can lift your bum off the ground. Whatever feels right to you. We're just trying to get the lower back and the hips to stretch out a little. So remember, you can tilt side to side here. We're just stretching the lower back with these little tilts. Okay, so the next thing you might want to try is just lifting your knee, pulling it up. You can press on the top, you can press here, you can lay this flat if you want a bigger stretch, or bend your knee if you're not that flexible. So we're just, again, trying to work with the lower back. You can kind of do like little turns if you want. You can just stretch. However you can kind of open it up. You can go back and forth, pull it towards you. We're just working on that lower back. You should feel it in here. And you just sort of move until you feel it. Now, when you move, like for me, if I move this way, I feel it. So I stop. I don't, ram into it. I just come up to where it hurts, where the tension is, and I softly just hold. I might do a little shaking here, just a little bounce, and then I breathe. Exhale where the tension is, because the goal is to release the tension. So we come up to the tension, we feel the tension, and then we mentally, in our mind, tell our body, relax. And we do an exhale to exaggerate the relax. Bring your energy and tell your energy in your mind to relax and release the muscles as you just hold up to the edge of your comfort. And almost imagine yourself falling asleep in this position, getting very comfortable and allowing it. That's how we start to release the muscles rather than, jam into them and hold tight tension the whole time. The goal is to release tension. Okay, and once you're done with that, you're just gonna bring your knees straight and you're gonna go to one side. Try to keep your hip on the ground. You're gonna bring them up and go to the other. So you just keep your feet where they are in the position so they're straight when you come up. And you just practice rotating through. Again, you'll feel this in your lower back. And the goal is just go to where you feel the tension. Keep your arms on the ground. And release. Try to release your mind, try to release your breath, and try to release your muscles all at one time.
Okay, so come up onto your knees, and this is just the simple cat-cow. You're just gonna go up. You're gonna do a cat, and you're gonna do a cow. You can walk your hands a little closer or a little further apart. It depends on how much stretching you can do. You arch it, breathe. Okay, you can just do little ones. Wiggle your bum side to side while you're up here. Working with the lower back. This is sort of similar to the one we did on our back. But again, when you're done, I like to come down and just stretch out the lower back. You can come onto your arms and just rock back and forth. Just stretch it out. And again, just wiggle. Forward and back and side to side. The other thing I like to do for the lower back is to get into just a position like this, and you're just gonna raise your hips and lower your hips. You can bring your feet off the floor if you want to stretch your hips a bit. You can reach with your hands. But even just the little movements side to side are gonna help with the lower back. Okay, if you have an exercise ball, I like the exercise ball a lot. Sitting on the ball, you're just gonna bring your hip forward and back. So again, it's a little pelvic tilt. See if I can show you from the side. There you go. I like the exercise ball. It's just really easy. You can make the movements more exaggerated. You can really stretch that lower back and do little tilts like this. Or you can just do bigger balls until the ball hits the back of your legs and forward. Okay? The other thing I like about the exercise ball is just to do little bounces. This is really great for your lymph system, but also as you're doing it, you can kind of rock. So back, forward. This is really gonna be great for your lower back. While you're on the ball, you can lift one foot, set it down, lift the other foot, very gently. We're working the lower back here, but again, we don't want to do anything that will strain the back. So easy movements are the best. Little bounces, little rolls. Allow yourself to work the back out. And remember, our goal is to relax it. So as we're moving, do a stretch into it, and then breathe. Stretch forward. Breathe. Soft movements, okay? Just really easy on the body. One of my favorite moves is just the cross side to side full body stretch. So again, come down, place this hand on this knee, arm out, and just stretch. I'll show you from all sides so that you can see what it looks like. I'll show you sideways now. Just come down. And the other side. You can stretch your head. And there you have it. That's just a really great overall stretch for your back. Okay, now we're gonna work on the hamstring. So I have extremely tight hamstrings. So this is one of these exercises where you just bring your legs, you hold the back, and you're trying to straighten your leg. Okay, so you just hold the back of your leg and you try to straighten as far as it goes. Now I have extremely tight hamstrings and I can already feel it here. So if you also have extremely tight hamstrings and you can't bring it all the way up, you can use a towel. I'm gonna get my son's blanket. Just roll up a thin blanket or towel. Come on back down. Grab here. Throw it around your foot, back it off until you can straighten it, and then just pull it up. You only go to where you can straighten it. Now some people can go all the way up. I can only go here. Okay, that will just help. Now, when you're holding it here and you're trying to lift your leg up, when you feel the pull, I feel it right here. I like to gently rub these muscles. You can use a foam roller, you can use a ball. I like to work them here because they're active. So try the other foot. Again, just hold in. And as you go to lift it, if you feel tightening, just rub. You can feel the kind of knots and the balls. Just run your hand along them, doing little massages all the way along. This is really, you're really gonna feel yourself loosening your hamstrings here with the rubbing when they're activated. The next stretch is for your inner thighs. You can do this sitting up or laying down, but you're basically doing like a butterfly. I like to lay down for them. Again, we're opening up the hips. And we're just feeling the stretch in here. If you feel it, you can massage it out. You can lift up and massage it out here as you feel it, where you feel it. Next, we're gonna look at the calf muscles. So we're moving down the leg to the calf. So if you ever get these really sore muscles here, just grab a rolled up towel or a rolled up blanket. You can sit anywhere. You can sit on a chair, you can sit on a couch. You're gonna put the towel around your foot and just stretch it out by lifting it up. You're gonna feel it right in here. So just lift it up and you're gonna feel it on your calf muscles. You're gonna just feel that. You're gonna feel it in the bottom of your foot and all the way through here. So again, lifting up, trying the other foot. Now, as it comes up, you just go to where you can and then you breathe. Try releasing the tension as you're in that pose. So you feel it, but then you kind of want to relax it. You can also massage on the back of your calves as you're doing it with one hand. When it comes to foam rollers, you can choose one with ribs or you can choose a plain one. I like the plain one if you're in a lot of pain. It's a lot softer. You don't have to dig into the muscles as much, but one of these will really get in there as well. So it depends on what you want to try. Now you can just take the foam roller, put it underneath your hamstring, and you're just gonna roll. You have to move with it. You can feel that. You can even do the exercise with this. So put your foot out, flex, and then roll on the foam roller. Okay, because it's like it's massaging the muscle as you're doing the exercise. Put your weight on the foam roller. As you're doing any of the exercises, you can also just use it, roll up and down. You can use them here on the backs, and you just kind of roll, you just kind of move into them. You can kind of sit up, roll across them, just like so. You can do it again on the backs of your legs. You just use your hands to go back and forth. So again, I like the smooth ones, but if you really have practiced with the smooth one for a while and you want to get a little deeper, this will get those knots. Another really great calf muscle exercise is you go to a wall or a closed door, and you're gonna do a stretch where you keep this foot bent and this heel on the ground. So both heels on the ground, put your hands out in front of you on the wall, and you just push in. You're gonna feel that on the back of your calves, and you just hold. Switch sides. Keep your feet and your heels, especially this one, on the ground, and push. That is one of the best calf exercises that you can do. Now again, when you feel the burn, you just kind of sit there and relax, breathe. Plan to stay there a few minutes and see how loose and relaxed you can get those muscles as you're just bracing to the tightest part. Okay, so now that we've worked on the lower back, the hamstrings, the calves, we're gonna go to the feet. So these are some props I like to use. You can use a tennis ball. I have a little exercise ball here, or a tennis ball will do. This is a dryer ball, one of those balls that you throw in the dryer. It's just a silicone ball that helps from dryer lint. I like it because of all the spikes. It can really get into your feet and give you that pressure point massage. And you take a bottle of water and you freeze it. So this is a frozen bottle of water. So it's basically just like a cold pack or an ice pack. So these are the three props that I use for my feet. This trick is amazing. So you're gonna take your socks off and sit down anywhere, on a couch, on a chair. So I'm gonna go ahead and sit on my couch and put my water bottle on the ground. Okay, get a mat. And you wanna pull your toes back, flex them forward, flex them back. You can go on this side, you can go on this side. If it's too cold and you wanna work for longer, put your sock on. You can still get the benefit of the cold. It's still gonna work. You roll sort of this way, front and back, this way, and then flexing the toes up and down. Okay, just really get into that midsection there and work it with the ice. You can also put a bit more pressure by standing. Now you're really gonna put the pressure onto the foot. You can even lift your other foot kind of up and really get in there. Okay, this is a great trick with the ice, and you're really getting in there. flexing your toes. Similarly, you can use the exercise ball. You really want to massage around there. You can go back and forth, and go back and forth, up and down. Put all your weight on it and really get in there. Okay, you do it on both feet. It's better with your socks off, but again, for the cold, you might, if you can get it up on the balls of your feet too, and press, as well as right in the arch. Likewise, you can do it with the dryer ball, and you can feel the little pressure points. You can get it on your toes, pushing up on the balls of your feet and right in the arch. The tennis ball or the firm ball is going to give you a really big stretch, and this one will get a little bit more pressure points. Don't forget to do it on your heel, especially a lot of people have problems with their heel. Really work out the muscles with your heel. Okay, go onto the balls of your foot. Okay, you really want to work this out. But this one is magic. So go ahead and freeze a bottle and keep it in your freezer and give this a try. Okay, the next exercises that you're gonna wanna do is working with your toes. So again, you can work them by pulling them back and pushing them forward. Pulling them back and getting that nice stretch on the backs of your toes, or you can do it by standing. So we're really gonna do the standing exercise now. So again, you're gonna stand and you're gonna go up onto your toes. This is also gonna work your calves and down. Rotate and down, and just you're gonna feel it on your toes and on the balls of your feet. You can go up and down like this. You can go up together and down. You're gonna feel it in your hamstrings as well as your toes. And lastly, take a sit and do a massage on your foot. You can have somebody do this for you, or you can do it, but you really want to work in with your fingers. Right here, there's a long line, and you want to use your fingers. You can feel it. You really want to just press on it, and remember, if it's too much pressure, breathe. Keep it there and breathe. Soften. Okay, so we're working this muscle here, this long line. It will be a tight muscle. Okay, we can work the heel here. We can pull the toes back. We can massage on the balls of our feet. Press in there. Really work on each toe. But remember, right here is amazing if you can get your thumbs. Someone can do this for you, or you can do it for yourself, and you just want to hold. When it's too tight, you can flex as well while you're doing it. And as you flex, you really feel these muscles. So then release. Okay, flex, feel them, hold, and breathe. Release. So those are some great exercises that you can do, starting with your lower back, going all the way down, getting your hamstrings, your calves, your feet, the balls of your feet, your arches, and your heels. So you want to work all of it. But please remember the tips at the beginning of this video. What your minerals are like, what your vitamins are like, your diet is like, and please have the magnesium baths. Do the magnesium sprays on your legs. Relax them and soak them in the bath. This is gonna go an even longer way than the stretching. The one thing I would recommend not to do at all costs is to take painkillers. So any kind of even over-the-counter medication, ibuprofen, Tylenol, let alone the really, really heavy duty painkillers that are opioids and are very, very addictive. Also, muscle relaxants. We don't want to get addicted to muscle relaxants or muscle pills. Surgery, all of that is out. If you are considering doing surgery or getting on pain relieving medications, I want you to go read a book by Dr. John Sarno called Healing Back Pain. Or alternately, you can read this book by Ray Ozanich, and I did a review here on it. You can go check out this video. It's on pain, not necessarily leg pain, foot pain, back pain, but any kind of pain. And we're using the mind-body approach to heal pain. So again, there's so many things that you can do, from diet, minerals, supplements, vitamins, minerals, stretching, exercises, baths, relaxation, and then the mind-body healing work where we actually stop the circular pain cycle and we learn to retrain the brain, reprogram the mind, and dissolve the pain. I hope this was a useful video. If you liked it, give it a thumbs up, share it around, and I will see you in the next one.